In 2021 and 2022, the State Committee on Statistics conducted a national household survey in Uzbekistan with support from UNICEF. To get a full picture, it surveyed and to rounds a total of 15,059 households in both urban and rural areas across the country. In total, 17,610 respondents were interviewed. The survey showed good progress had been made towards improving the status of women and children in Uzbekistan, but it also identified areas where much more needs to be done. Over the past 2 years, almost all births in the country have been given in state medical institutions under the supervision of qualified healthcare personnel. Over the past 15 years, fewer children have died before their 5th birthday. 25 children per 1,000 die before they reach the age of 5. Of these, 17 die within the first 4 weeks of birth. All children in the country have an officially registered birth certificate. The importance of breastfeeding to ensure the full development of the child is widely known. However, only 2 out of 5 newborns are breastfed within the first hour after birth. Only 1 in 4 babies is exclusively breastfed until they are 6 months old. 7 out of 10 children aged 6 to 23 months get fed the recommended minimum number of times. 7% of children under the age of 5 are stunted, 2% are underweight, 2% are wasted, and 5% are overweight. The early years of a child are critical for cognitive, social, emotional, and physical development. Adult household members were involved in 4 or more developmental activities, with 78% of children aged 2 to 5 years, but fathers engaged in activities for early development with only 5% of children under 5. 96% of children aged 2 to 4 years are developmentally on track in terms of health, learning, and psychosocial well-being. 46% of children aged 3 to 5 years attend preschool. 72% of children participate in structured educational programs within a year before primary school entry age. All children completed the 4th grade, 98% completed the 9th grade, and 94% completed the 11th grade or professional colleges and academic lyceums. There are no significant differences in school attendance between boys and girls. 89% of mothers or caregivers believe that a child should not be physically punished, but almost 1 in 3 children aged 1 to 14 years receive physical punishment. 6 out of 10 children aged 1 to 14 years experienced a violent form of disciplining, that is, physical punishment and or psychological aggression, within a month before the survey. 1 out of 5 children aged 5 to 17 years is involved in economic activities or household chores. 3% of women were married before they reached the age of 18. 8 out of 10 women aged 15 to 24 years have heard of HIV, but only 1 in 10 has a comprehensive knowledge of HIV. Almost all children have been immunized by the age of 2 in accordance with the National Immunization Calendar of Uzbekistan. These numbers help us understand how to improve the lives of women and children in Uzbekistan.